Hello, Mr. Chairman, members of the committee. Thank you for taking the time to listen to me. I'm Mary Altenberg. I am currently the Executive Director of Community Dental Services, which is a nonprofit organization providing direct care in 3 needy neighborhoods in the Albuquerque metro area. However, we do see patients from all over the state, particularly the southeast corner of the state, where there are not many places where people can secure care when they are low or no income. I came here in 1973, got my bachelor's degree here, got my master's in community health here, and I've been working in public health for over 15 years. I'm not a dentist, I'm not a hygienist, but I fell into and have started with a passion and continued with a passion for improving oral health in the state of New Mexico. I started as the inaugural director of the IHS Albuquerque Area Dental Support Center here in New Mexico, serving all the tribes in New Mexico, Southern Colorado, and El Paso, Texas. From there, I went on to serve as the Department of Health Health Systems Bureau Chief, and as Bureau Chief, I oversaw the Office of Oral Health, the Office of Primary Care and Rural Health, and the Office of School and Adolescent Health, all of which had connections regarding oral health issues in our state. So I have this background, and now I am serving as the Executive Director of Community Dental Services, and I have to tell you, it is an absolute treasure in the neighborhoods in which it serves. It was established in 1974, so they've been there almost 40 years. They serve over 11,000 individual patients every year. And we're only one of a handful of dental clinics in the metro area that serves low and no income individuals, particularly adults. There are a lot of places that are serving children with Medicaid, a lot of corporate dentistry places, but very few that serve adults, and that is where some of our greatest need is. At Community Dental, we provide a full range of dental services, all the way from prevention to complex treatment, as well as orthodontic services. We also serve emergency patients, and as I said, we serve over 100 emergency patients. Those patients would otherwise go to the emergency room, costing our system a great deal more than when they come here. So we see everybody. We see the neediest, but we also practice the highest quality dental care. So anyone is welcome to come. We take low, no income, all insurances, self-pay. We have a working relationship with the Veterans Administration because they have a bottleneck of veterans needing prosthetic services. They need dentures and they need crowns and bridges. And so we are now seeing an overflow and are happy to do so. We are proud to do so, of serving veterans who are greatly in need of our services. We are also seeing more and more people with developmental disabilities because Carrie Tingley is struggling, as is the state office serving dental patients. Our mission at Community Dental Services is to provide quality care to individuals who might not otherwise have access to dental treatment because of their inability to pay. We have 40 people serving on our staff, 6 dentists, and the rest are all dental assistants, hygienists, support staff. And other than the dentist, every other staff member there is from the communities that we serve, every single one of them. So it is a workforce area that serves the community in that way. We are facing a lot of challenges at Community Dental Services, and it really is particularly challenging right now. We all know that state funds were cut. I think about 2008 they started making the cuts to DOH, which cut our funds. We receive payment from state, county, and city funds to provide indigent care. We've seen those reimbursement rates drop. Medicaid rates for dental services have not been raised in years. And the cost of providing dentistry has grown. As you've heard, dentists come out of school with tremendous debt. They have a need to go where they're going to get paid well and where they can practice. It's difficult to have recruit dentists to where we are because we cannot pay what some of the other practices can pay. We serve the low-income, uninsured population, so quite often they can't pay us. We cannot, because of our agreements with the state, county, and city, we cannot turn anybody away for inability to pay. We have to serve them, whether we get paid for it or not. We have unique populations. Sometimes they have behavioral health issues. They're not always easy to deal with. We have patients with PTSD, with trauma. We have substance abuse issues. We deal with some of the most difficult patients there are. And we need providers that understand our patients. So to talk to you about the dental therapist, that to me makes the greatest sense right now to fill a gap in access to care. We're having our dentists come out of college with tremendous debt. We can't afford to pay them what they need to support themselves as well as meet their loan obligations. Equipment is growing, and if we were to get a dental therapist into our system, they would be able to meet those needs of individuals with the simple extractions, with those prevention services, because we don't want to just be treating people. We actually want to improve the oral health status of our communities. And if all we're doing is pulling teeth one after the other and not taking the time to actually improve their oral health, we're going to be doing that until we're not going to make any kind of difference. We're not really going to make any kind of meaningful difference. Having a dental health therapist is a way to bring in that gap, to fill the need of the simple extractions, to take away those kinds of drill and fill, kind of even bread and butter, if you want to think about it, services, to allow our dentists to concentrate on our medically complex, difficult procedures, difficult diagnoses. Again, with many of our patients, they're medically complex as well. It's not as easy. They have so many different medications, so many different chronic diseases. It's not an easy thing to do. Having the dental therapist there would help ease the burden and allow them to concentrate on those more complex procedures. Again, it's a total cost saving. I mean, we can give you numbers. We can present you with reports that talk about the financial viability. I don't have those numbers memorized. I just know it's something that makes sense. It's high quality. Nobody wants to bring people in and give them poor quality services, and that would be a disgrace. No one would do that. So we would like to see at Community Dental Services a dental therapist who becomes part of our team, who helps us become a true community partner, not just sitting back in our clinic treating disease, but actually working as partners in the community, making a difference so that we reduce the level of disease in our communities. And so I think I kind of went off topic, but I get pretty passionate about this issue. I really do care about the communities that we serve. And I haven't seen much of a change since I was working with the Indian Health Service. I haven't seen a tremendous amount of improvement in oral health in our communities. And I think this is one way. There are lots of different solutions that we can engage in, but I think dental therapy is the wave of the future, and I think it would be tremendously positive for New Mexico to agree to this kind of a model. Thank you very much.